All right. Hey, everybody. We are just going to give Nina a minute to join. Actually, I think they are here. Hi, Nina.
Hello.
I am so glad that you're here. I'm so excited to talk to you today. I was just getting set up, so I'm just going to do a little introduction and then I'll have you introduce yourself and then we can go ahead and get started.
Wonderful.
But hi, everybody that's here. So glad you're all here. I'm excited to talk about our topic today. For those of you who don't know who I am, my name is Matthew Murray. I use he, him pronouns. I'm a doctoral candidate, clinician, and researcher specializing in eating disorders, particularly how they intersect with sexuality, gender identity. I'm also one of the facilitators for the Alliance's Wednesday evening LGBTQ plus pro recovery eating disorder support group. So for anybody that might be new to the Alliance is the leading national nonprofit organization that offers outreach, education, early intervention, support, and advocacy services for eating disorders. So if you or anybody that you know is struggling with an eating disorder, help is available. So please reach out to the Alliance. They have extensive referral services and they have several free weekly clinician led eating disorder support groups and groups for loved ones. So, like I said, Nina, I'm so excited that you're here. Really looking forward to having this conversation. So, to get started, before we jump in, can you please introduce yourself, tell us a little bit about Them's Health, and tell us what inspired you to launch it?
Yeah, cool. Thank you for having me. I'm excited to have this conversation today. Yeah, so my name is Nina. I use pronouns they, them, and she, her, and I'm the creator of an Instagram account called Them's Health. I started it around 2 years ago, kind of purely just seeing a gap in terms of information around health and wellness for queer, trans, and non-binary people. It's been like a passion project on the side for me for the entire 2 years. So I'm by no means an expert. I haven't necessarily studied in health and wellness fields necessarily, but I think that that sort of speaks to the LGBTQ community in particular in terms of how we become our own experts and we become our own advocates in health and wellness spaces because the culture at large isn't necessarily built to include us. So yes, that's them's health.
Awesome. Well, I definitely agree. When you hold identities that are historically excluded from health and wellness, then you really don't have a lot of options but to sort of figure that out from your own lived experience or also seek community who can help you sort of navigate that, which is part of why I'm really excited to talk about this today, because I think that's sort of the foundation of everything we're talking about is community and community care and how that is important for health and wellness. So our topic today is gender bias in the health and wellness space. Before we dig into that, could you explain from your understanding what that really means for anybody who might be unfamiliar?
Gender bias in the health and wellness space.
Yeah.
Yeah, I mean, I guess from my again an expert opinion on this side, it's just we live in a very binary, very heteronormative world, right? So we live in a world where the assumptions that there are male and female, and that there are specific attributes or behaviors that align with being male or female. But what we know as far as the queer community, of course, is that gender is an endless expanse of identities, and that the classic, or I don't know, classic's a bad word for it, but like the stereotypical masculine or feminine behaviors or traits aren't necessarily aligned with gender identity, and that it's all sort of up to the person, really, in my view. So I think that because those two binaries in that heteronormative world has sort of that is the world that we live in, that is the world we live in when it comes to health and wellness. And so that can be assumptions of how to hold space on one hand. So with something like, I don't know, like menstruation, for instance, we're only now finally getting to a conversation that it's not just women who menstruate, or it's not just women who can carry a child. And then similarly, or on the, I guess not similarly, but on the other hand, then it gets into the space of the um, heteropatriarchal society that believes in two genders, what that does in terms of clinical research is means that we're drastically underinformed in studies when it comes to queer, trans, non-binary people. So off the top of my head, that's even thinking about something like um, the newer form of PrEP, Descovy, and that the earliest studies didn't include people who were assigned female at birth because of the assumptions of who needs to have PrEP being people assigned male at birth, or cis gay men or trans women. So it's like across the spectrum, the norms sort of impose themselves on the health and wellness space.
Yeah, totally. And I think, part of what happens, I agree with you. I think recognition is increasing around certain issues that, more than just the people that we expect are experiencing that. Certainly we see that with eating disorders. There's more recognition that people who are not cisgender, heterosexual, white females have eating disorders. But to your point, there's this lag where, although there's more recognition, a lot of times what happens is then we take everything we've learned on that very specific population and then unilaterally try to apply it to everyone without, consideration of the nuance and the complexity of their specific experiences and needs. So it's kind of like an added problem to the recognition, which had to come first, but now there's this lag behind it.
Yeah. Sorry, my dog is barking over there. Yeah.
I'm in Chicago, so there's always some kind of siren or something.
Yeah.
Going on outside. Okay, so in thinking about that and thinking about some of the biases that you just talked about in health and wellness, I was hoping we could look at this from sort of both perspectives, from the provider perspective of health and wellness services, and then also from the perspective of people who are seeking those services. So I'm thinking about sort of the provider perspective first, and your understanding. Can you say a little bit about the role that providers play as sort of stakeholders in the health and wellness landscape? What level of responsibility do providers have in breaking down some of these biases, some of these barriers?
Yeah, I mean, I think providers hold a lot of responsibility and they hold a lot of power, right? So then there are some medications that people very much need that a provider is required to have access to. So that could be something like PrEP, it could be something like hormone replacement therapy, it could be something for any other pre-existing conditions like high blood pressure or anything. But if you don't feel safe going to a doctor because you don't feel confident that they understand your gender or your sexuality or have respect for your size, that you're not going to go see the doctor. And that's a whole waterfall of issues that could happen because someone has fear that they can't go see a provider that's they are. As far as weight goes, I think that's at least to me something so beyond gender, but also entirely inclusive of gender in terms of the number of people I know personally or I've observed on the internet, myself included, who avoid going to the doctor because the first thing that someone says is like, well, you need to lose weight. And you're like, everything on my chart says that I'm 100% fine, but the default is to lose weight because that's just how providers have been taught, that weight loss is like the thing. So like that implies health when it's not. And so I think that that's one part. And then I think that, not to like immediately jump to the defense of providers necessarily, because I think there's a lot of education that has to be done as an individual, but I mean, the healthcare education system isn't built to be inclusive, right? Like it's not equitable, it's not inclusive, it's super expensive. Like the amount of people who could be providers, who want to become providers, but the literal barrier is not their drive or their education or their ability to learn. It's purely money to become a nurse practitioner, PA, a doctor, any of that. And so I think I just went on a full tangent as far as provider responsibility, but I don't know, I've heard from different people that it's like, you have like a day, a week on LGBTQ healthcare. I'm not as certain on, I don't know if health at every size is being taught in any places. Maybe I'm not feeling optimistic that it is.
Yeah, me neither.
Yeah. So yeah, I think that we're not setting up providers necessarily to have all of the information they need or have the most intersectional information to care best for all types of people. And yet they still hold a lot of power. And so I think that there's we're in like in a world where we've sort of been told that like the doctor knows best. I think for LGBTQ people in particular, like the doctor often doesn't know best.
Yeah. Yeah, I totally agree with you. And I know certainly education is one of the biggest issues. We have that same issue with eating disorders. You know, a lot of times it's a day, a lot of times it's really outdated information or actively harmful information. And then that just gets sort of perpetrated again and again and again. But I do think, you know, sort of something that can happen too, at least from a mental health perspective, is sometimes we kind of get stuck in this trap of trying to teach people to cope better with the problems of that system instead of sort of claiming the responsibility and the power that we have in trying to dismantle some of those things ourselves. And so, you know, on the one hand, I think coping with that system is really important because it's the one that we have. And on the other hand, I think there is an important question for providers to be thinking about in terms of, you know, how that might still be perpetuating some of those systems of harm.
Yeah. Yeah.
Yeah. If I might add to that too, the other thing I was thinking in general is like for any providers listening, I think just taking people's concerns seriously. You know, if they don't fit the mold of sort of what you expect, that doesn't mean their concerns are any less serious. I think especially with something around weight. And for anyone listening, if you're not familiar with what Nina mentioned about health at every size, it's a movement that the basic tenet of is that health is not determinant of size. And a nice sort of add on to that is that health is also not determinant of value. And so I would definitely encourage you all to look into that. So thinking about that then from the other kind of perspective, and you mentioned earlier that people don't always have access to sort of safe, affirming, knowledgeable providers or spaces. Do you have any tips or advice for people who are looking to advocate for themselves in health and wellness settings around things like gender, around things like size?
Yeah, I mean, I think it so depends on the provider that someone is seeing. And so I think that that's like a place to start, which sort of, as you were saying, like the coping with the system. I think I thought I'm about to share, it's more about like coping with the system that exists. That like, I think you sort of preempt a lot of that stress by finding a provider through LGBTQ networks, maybe, or through friends, or through different like online forums is an option in terms of finding a provider that other people can vouch for as like, this is the person that I trust. So for me, that's how I found my provider, was through other queer people in where I live. But I also recognize, like, I live in New York. There are a lot of providers here, a lot of queer providers. So I think that that's like one place of, I don't know, if research as advocacy, I guess, of like sort of protecting yourself by doing some type of research in terms of finding a provider who others can say is trusting of people's own intuition around their own bodies. As far as like being in a room with a provider or in a Zoom, since this is our weird reality right now, I don't know, that one's a lot harder. I think it's really hard in those moments because how our system is constructed. Like, it takes so long to get an appointment. So by the time you're there, you're like, fuck, like, what do I ask? I'm sorry, I don't know if I can cuss here, but we did it. But yeah, I think that it's almost like my perspective is just coming in prepared, whether it's preparing and researching, finding a provider that feels safer, or if seeing a provider that you've not seen before, like making sure that you know what you might want to get out of a visit, and having those things written down for yourself to be like, okay, like, even if this provider steers me in some other direction and like I just want to like make sure that my blood pressure is fine or whatever, but they're talking to me about weight, even though I've been the same weight my whole life, whatever it is, that you sort of press on that specific answer. But I think that it's also, I think like coming up with tips for self-advocacy, especially for LGBTQ people, is like, that's a hard one to navigate, I think, because there are so many stats out there that LGBTQ people and trans people in particular are at higher risk for verbal harassment by providers, or they are at risk for even physical violence by providers. And those numbers for the community aren't something to be sort of ignored. I think in terms of advocating for yourself, is that if you're you know, again, back to the idea that we're still in a time and place where like doctor knows best or whatever it is, that advocating for yourself could put yourself in a position of harm, which is like a really upsetting thing to think about when we're like, but they're supposed to help.
Yeah. And I think it's such a burden too,
Yeah.
you know, for you're going to a provider to seek care, to seek help, that their job is to provide you care. And then there's this added layer of you needing to educate them or provide them with information that they should already have or should have the skills to be able to seek out on their own, right? I think that's something that comes up frequently.
Yeah, I mean, even when like recommendations for finding different gender or sexuality affirming care, when you, if you were to Google like how to get on hormones or like how to get on PrEP or like whatever it is, oftentimes first recommendations are like talk to your provider, and you're like, wow, that we're at a place that like the assumption is that you can just talk to your provider, right? Like we still have so far to go that like for some people they're not going to talk to their provider. Maybe they've been seeing the same like family doctor since they were 12, and like that's not going to be the first person they might want to ask. Or it is. I don't know. It really depends. But yeah, I think those assumptions that like surely this trained professional is here to help, but I think we've just seen time and time again through the community that that's not necessarily the case. And then I think like the added layer of weight stigma for people who have questions around their own gender or sexuality care is that like those are going to be veered totally off course if someone's like, well, you need to lose weight, and you're like, about what? Why are we talking about that?
Yeah.
And yeah, so I think it's, I don't know, it feels bad. We're a little bit, we're the most helpful things to be like, I don't know, like steel yourself just in case it doesn't go well. I don't know.
Yeah. Kind of thinking about that, and I know we've talked quite a bit already about weight stigma, and I do want to talk more about that because I think it's so important and a really big sort of intersecting factor,
Yeah.
which eating disorders and our general topic today. But in thinking about kind of having to steel yourself a little bit, I do want to come back to the idea of community, what makes community so helpful and important, and also what you mentioned earlier about, you know, sort of using your queer networks to find
Yeah.
people who are safe or who are affirming. In the work that you've done and in building Them's Health and with its growth, how have you sort of seen that play out? Or have you seen any shifts through Them's Health in that community building, why that community building is important, and sort of what that looks like?
Yeah, I mean, I think that the biggest thing I've seen, one of the biggest things I've seen that was like the most telling, I think, was towards the beginning of Them's Health. I had a lot more capacity. I've been a different professional life lately, so not the same volume. But a big thing I was doing for the first like year and a half of Them's Health in particular was this thing called Ask a Demfessional, and I was working with different, mostly nurse practitioners who would answer questions from the community about common things that would come up. But the thing that was most telling is that the types of questions that I was getting in the DMs from people were so specific and so personal, and it was less of it, to me, that spoke volumes about how lacking the healthcare system actually is, where people felt more comfortable asking like an Instagram account about their body than they felt asking a provider, or seemingly didn't have access to a provider to ask. So I think that as far as learnings go, I think that's still been a big piece of it for me, is seeing how much information is helpful through like infographics on Instagram or resource sharing in that way. So I don't know if that's one part, but I think the other is around specific gender and sexuality care, especially. There's always, I think, as far as like bodily care things on themselves, there's always a lot of conversation around hormones or around surgery, because those groups, like that's not always easily accessible from a doctor, and there's not as much research, and a lot of what we know is from personal experiences and personal experiences being shared and people trying to map themselves onto those experiences as they best can, because we don't have massive studies, and even then I don't even know if that's like the best help for people at a certain point. But yeah, I think that's been the most of it from themselves. And then the other piece being, I think that like, I know that I take it for granted living in New York, like having a massive queer, trans, non-binary community around me, but even just like affirmations and like reminders that people and like their experiences and their body in particular are valid and are their own, and those seem to resonate a lot with people, that it's just sort of a reminder for me from like the New York City bubble for sure, of like how far we have to go to say that like no, like you should be the one in control of your body.
Yeah, I really appreciate you saying that, because I see that play out in group every week. Just the power that exists in having a network of people who speak your language and
Yeah.
understand your experiences and who can relate to them. And I think especially with eating disorders, something we run into a lot, going back to what we've been talking about, trying to sort of apply all the information learned about a specific group of people to everybody else. For trans and non-binary folks, there's just this massive misunderstanding and sort of active neglect of the complexity that exists between body and eating disorder, and sort of how to reconcile those two things, which is so, I think, critical for healing for a lot of folks,
Yeah.
but inaccessible in treatment spaces. And so a lot of times where those conversations are being had is just like you said, online, on Instagram, in a group with people who get it.
Yeah. Yeah, and I think like this is sort of like nerdy on the them's health, like the metric side, is that the number of posts that are like medically helpful or directive, I guess, a lot of those have a lot of saves that people save. Like they're not engaging with them, but it's information that's out there that's helpful in a way that people save it to come back to for themselves later. And I think that like also finding ways, I think different ways for people to be anonymous in those spaces, which I know is a little bit different a group, but also then that's where like the group becomes like a step for someone into maybe one of their first queer spaces or something, to be able to like go from reading alone and finding what you need for yourself into like moving into a space where there are others who you can identify with.
Yeah, which is what makes something like Them's Health so important, is it gives people that stepping stone to, whatever they need.
Yeah.
If they need care, if they need a bigger community. So I'm glad that it's there.
Yeah.
Okay, before we run out of time too soon, I did want to come back to weight stigma, because we've talked about it quite a bit, and I think it's really important. As we've talked about, weight and weight loss in particular are oftentimes really frequent emphases in health and wellness settings, and a lot of times can be used as sort of a gatekeeping strategy to access to services, whether that be general sort of medical services, gender confirming services. So from the work that you do, can you speak a little bit more about sort of where you see the intersections of gender bias and weight stigma?
Yeah, I mean, I think that there's so there's someone I follow on Instagram named Dr. San Chang, and they're talking about just the idea of like those who are more likely to be under their own like body surveillance. So the higher levels of attention to gender, especially for trans and non-binary people, where you're maybe thinking about your body a lot more because of whatever form it's taken and you're in it right now. And so that extra attention to maybe the body parts that make you feel dysphoric or dysmorphic in your gender and in your body can, because of that attention, lead to different disordered eating or disordered exercise behaviors or whatever it may be. And so I think that is a massive intersection for the community in terms of like the attention paid to body and to finding your own gender and how you want to be in your body. And then where that comes in like even more tangibly in sort of an alarming way, I think it's especially around gender affirming surgeries. And it's really, really mixed by provider. And so some surgeons literally ask people to lose like 50 pounds before they'll consider a surgery. And like that is, I don't know what else would be like an trigger into an eating disorder than something like that, saying like, well, to be in the body that you want to be in, you should do this. And like no matter how realistic that may be based on the person's like physical makeup, anatomy, DNA, all of it. But then other surgeons that I've talked to, a lot of them are just like, no, like why would they need to do that? That's a reflection on the surgeon and the surgeon's own bias and not the individual. But I think, again, because like it's hit or miss where you come across that information. So if you're only meeting with surgeons near you and you don't have a ton of network to like cross-reference with others, that may just be the reality. And you're like, all right, well, I guess I'm going to figure out how to lose 50 pounds. And like that could be really bad for someone.
Yeah.
And so, yeah, I think that those are like immediate ones. And then, I mean, they're all immediate ones, right? And then there are other ways like gender affirming hormones and everything like those, how those change like the muscle and fat distribution in somebody's body could also be triggering, right? Seeing, because you don't know what your body is going to look like as you take hormones until you take hormones. And sometimes that shift can be a challenge for people depending on what happens, whether they lose weight or whether they gain weight or whatever it might be in those body fluctuations. And that's just another symptom of like a culture that's so obsessed with bodies being a certain way that it's just another layer on top of someone trying to find their own. So I don't know, layer on layer on layer of complexity.
Yeah, definitely really complex, but I appreciate you bringing all of those points up because I think these are sort of the points, exactly what I was thinking about earlier when I was talking about how, providers might not necessarily understand the complexity of body and eating disorder and recovery for trans and non-binary folks. And that's everything you just shared is a really good example of where some of that complexity lies, right? And how to hold space for both of those things because, I think sometimes what can happen is gender identity, gender expression, and body safety, body trust, some of those things can be put to the side sometimes in treatment spaces, which of course can be extremely harmful. And so, how can we better bridge those two things so that people are getting everything that they need in the same space, I think is super important.
Yeah.
I think consideration of those things is one way to start that.
Yeah. And I mean, I think even not to like keep adding on layers to keep adding on layers to be aware of all of them.
Yeah.
There are those that are really, really physical and immediate to how someone exists in their body and how they're paying attention to their body or how they're working to change their body with hormones or with surgery and those methods. And then there's just like, what is it, like minority stress? And just literally the anxiety of being a minority contributing to someone's disordered eating behaviors, like as a coping mechanism to a world that, I mean, as we keep seeing, especially in the last year, a world or a country in the US in particular that's like telling you that you aren't worthy. And so just purely that stress alone, separate from like the medical options or work to shift someone's body to make it be what they want it to be, just like that, just like living and trying to be your wonderful like queer trans non-binary self, whatever it is, and then the world being like no. So that's like another intersection I think that's really important.
Yeah, critical. And you're right, minority stress is one of, if not the biggest predictors of a lot of the reason we see higher psychological distress in queer folks and trans and non-binary folks. And with eating disorder recovery in general, because you have to recover to a world that's hostile to you in a lot of ways. And so it kind of comes back to the question of, how can we help people cope with that? And at the same time, the people who hold the power in these circumstances, the providers, how can they take responsibility for that and, help break down some of these barriers that are perpetuating those systems of harm? Yeah. Which, of course, like everything we've talked about, is a very complex and multi-layered issue, but I think important for folks to think about.
Yeah, and I mean, I don't know. Sorry, I don't know if we have time to go for it. Do we have time to like go for one more thought that I have?
Yeah, please share it.
So knowing that already gender and sexuality are a massively intersectional topic, that we can't also talk about that without also talking about race. Mm-hmm. And so then the preconceptions of what healthy food is, especially in the United States, can often be very exclusive of foods that are unique to someone's racial or ethnic background. And so then if we're coming from a place in the US where it's just like, I don't know, kale, quinoa, and boiled chicken or whatever, like, I don't want that. I don't know. That's not it for me. And so I think that extra layer of like how people's relationship to food to begin with, that like recommendations of what types of food people should be eating, but if that's not culturally sensitive, that's just another layer of minority stress and another layer of like a white cisgender heterosexual like patriarchal society imposing what people should be doing for their bodies, and like that perpetuation. I just didn't want to I didn't want to leave out also the additional layer of race and ethnicity in all of this as well. But I know
Yeah,
that's very
definitely. Yeah, thank you for bringing it in, because I agree it's really important, and I think too that's where it can get tricky when we talk about health, because a lot of times we talk about health behaviors with folks as though they have access to the resources to engage in those health behaviors, and a lot of times they don't, right? Which is why I think going back to health is not a determinant of value. That's part of the reason why, and that I think just also speaks back to sort of all these institutional and structural issues contributing to these problems that really need to be broken down. So thank you for bringing that in. But before we run out of time, the last sort of thing I wanted to ask you, and in general, again, thank you so much for being here and speaking with me on, I think, such a critical issue in the health and wellness sphere. I know I've learned a lot from you, and I'm really glad that we have this platform for you to share that information for everybody that's listening. But the last sort of thing I wanted to ask you, which is a pretty broad question, is what does the future outside of the binary look like to you? What does a gender expansive future look like, and how can we help people move along to get us there?
I mean, oh man, whew, that's a big one.
Yes.
I mean, I think a world in where people don't have to feel stress in thinking about how they live in their bodies and present themselves. And that feels like a super simplistic way of saying like culture needs to catch up to allow people to be whatever gender they are and to like let them live and have it be not an issue. And it means education and healthcare that is inclusive of all bodies and sizes. And it means, I think, a freedom for all people to explore whatever it is that speaks to them, to be in their bodies and in their genders and in their sexualities, and doesn't feel policed by everything that we have right now. And yeah, I don't know. I think just a world where people can live without that anxiety and like get to be in their bodies however they want. People of all genders, sexualities, races, abilities, all of it. I don't know. That's my hopeful vision.
Well, I'm definitely hopeful for that too. And so again, I'm glad that we have a space here to talk about that, and so people can feel validated in that, and also learn how to help us move towards that space where people can be free to be who they are without question. Um, so, do you have any final thoughts on what we talked about today, and where can people find you? Website, socials, things like that.
Yeah, so the best place to keep in touch with me is on Them's Health Instagram. And yeah, I don't know, everyone, however you are in your body, you should just like be able to be in your body. And I'm here to cheerlead you, and I know there's a massive community here to cheerlead you to do that. And we'll work together to make sure healthcare and everything else catches up.
Oh, okay. Well, thank you again, Nina. Thank you to Them's Health, and thank you everyone that was here to participate and listen. I hope that today's conversation really reiterates for everybody that you're not alone in any of these experiences that you might have. And so I encourage everybody to engage with Them's Health, engage with the Alliance. If you're a provider, you can continue learning from both of us, both of these organizations. For anybody that might be struggling with an eating disorder, we're here for you. If you're a queer person struggling with an eating disorder, we see you. You deserve support. So please join us for our LGBTQ plus pro recovery eating disorder support group that is free and meets every Wednesday at 7 p.m. Eastern, including tonight. So you can find information for that group and other Alliance support groups and referral services here on the Alliance's Instagram or on their website, which is allianceforeatingdisorders.com. You do need to register for support group. This conversation will also be saved on their page if you want to check it out later or share it with anyone. But all of that said, thank you all so much again. Thank you, Nina, and I hope everybody has a good rest of your day.
Thank you.